Hi friends, welcome to my new video. Today we are going to discuss about an infection related to your Achilles tendon. That's commonly called as Achilles tendinitis. So we are going to discuss about this disease in detail. So don't skip this video, let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
So what is Achilles tendinitis? When there is any infection to your tendon, mainly Achilles tendon, that will leads to this common condition called as Achilles tendinitis. You have to note that this Achilles tendon is the strongest tendon in your body. It mainly helps to and it mainly connects your heel bone to your calf muscle. And this Achilles tendon mainly helps to walking, running and jumping and so many purposes. So when there is any infection to this Achilles tendon, that will leads to this condition called as Achilles tendinitis. What are the common causes for this Achilles tendinitis? Mainly it will causes due to three reasons. The first common reason is whether there is any infection to your Achilles tendon, that is Achilles tendinitis. And the second thing is when there is any degeneration to your tendon. It is otherwise called as Achilles tendinosis. And the third thing is whether there is any rupture to this Achilles tendon. Maybe overuse of this Achilles tendon, and it is commonly seen in athletes. What are the major types of this Achilles tendinitis? Mainly it consists of two types. The first one is non-insertional and the second one is insertional. In non-insertional, it mainly affects the middle layer of the tendon that goes to any breakdown or rupture, and it is commonly seen in young people and more active people. And the second one is insertional, in the sense it mainly affects the lower part of the heel that mainly connects the heel bone to this calf muscle, and it is commonly seen in the people who are in active and mainly in some kind of a sports person. So these are all the common types of this Achilles tendinitis. What are all the common risks for this Achilles tendinitis? Mainly the people who are mostly laborers can affect this disease, and the second thing is who are running, dancing and the athletes, and the main thing is who have any weak calf muscles, and the next thing is who have flat arches, bone spurs and pronation. All these are the major risk factor for this Achilles tendinitis. And the symptoms mainly including you may get a heel pain, and the next thing is you may your leg may be go for weakness, that may be leg weakness, and you may get a stiffness, discomfort while walking or climbing a stair, and the last common symptom is your heels may get swollen or swelling in the heel part. So these are all the major symptoms for this Achilles tendinitis. And the diagnostic method mainly including a CT scan, MRI, X-ray and mainly a physical examination to find out whether there is any edema or any swelling. And the treatment methods mainly including pharmacological and non-pharmacological, and mainly a surgical method. In non-pharmacological method, you have to follow a RICE technique. RICE technique in the sense provide rest and ice, mainly putting ice on your tendon to reduce the pain, and the compression technique and the elevation technique to reduce the edema. And the pharmacological method mainly including NSAIDs, that mainly helpful to reduce your pain by giving a painkillers, and exercises mainly calf stretches and walking shoes and supportive therapy or physical therapy, and mainly supportive footwears that helps to reduce or prevent the complications. And other technique including Brisman therapy, and the next one is shockwave therapy, and surgical technique including gastrocnemius recession technique, and debridement and repair, and debridement with tendon transfer. So these are all the major surgical method for this prevent the complications of this Achilles tendinitis. So these are all the main thing about this Achilles tendinitis, and next day I will reach you with another topic. Thank you all. Have a nice day.